In this video, we're going to talk about what you really need to know if you've been told that cam-type hip impingement is causing your hip pain. I'm Matt Hsu from Upright Health, where we help you move beyond your limitations so you can live with confidence. Be sure to check out the description box for helpful links about FAI, as well as a link to the FAI Fix program and a calendar of events for our upcoming workshops and seminars. Over the last several years, my team and I have worked with a lot of people with hip pain problems. We've had people who have cam impingement, pincer impingement, arthritis, labral tears, you name it, they've had it. And what we found is oftentimes the people we work with aren't aware of the research that's out there about things like cam impingement. And in fact, the doctors themselves aren't aware of the research around cam impingement and what it really has to do with hip pain. So in this video, we're going to talk about one key piece of information that people seem to be missing about cam impingement. When you're told that you have cam impingement, the theory is that the bad shape of the bones is what causes your hip pain. So if you have hip pain and they see in an x-ray or an MRI that you have the bad bone shapes, that the bone shapes are causing your problem. And if the bone shapes are causing the problem and causing that pain, then the only solution is to shave down the bone to correct the problem. Now, does that theory always make sense? The reality is no, it doesn't. Why doesn't this theory make sense? Well, let's look at it closely. We need to establish that the cam impingement actually causes hip pain. So if we looked at a bunch of people with cam impingement and they all had hip pain, it'd be a very simple situation. We'd say, okay, this person has cam impingement, they have hip pain. They're probably related, especially if we see that a ton of people, like 1,000 people, all have cam impingement and all have hip pain, and then we see that another 1,000 people with no hip pain have no cam impingement. Then it starts to look like, okay, the cam impingement might be the deciding factor. In the real world, however, that's not how it works. Cam impingement is actually really common in people with no hip pain. So this is where doctors will say, well, that's because the cam impingement is probably not yet symptomatic, but it will cause you hip pain and arthritis in the future. Now, is that true? Well, you'll be surprised to find out that somebody actually did some research on this. Now, how would you study this problem? Well, you would think about the explanatory power of this theory. If cam impingement is going to lead to arthritis later down the line, then we'll probably see it in people who are older and have cam impingement. So what the researchers did in the study that I'm going to leave a link to in the description box was look at over 500 elite level senior age athletes, and they took x-rays of their hips to see, well, what's the relationship between their cam impingement, if they have it, and arthritis. They also looked at dysplasia and pincer impingement, and what they found was there was no relationship between cam impingement and osteoarthritis of the hip in these athletes. The average age of these athletes was 67 years old. So there was no established relationship at all between cam impingement and the development of arthritis in these senior age athletes. So what does this mean if you have cam impingement? Well, first of all, it means you can relax a little bit because the cam impingement apparently doesn't cause arthritis. There's no relationship between cam impingement and arthritis. And if you have mixed impingement, what they found was, hey, you can also relax there too, because 83% of this group of athletes had signs of FAI, femoral acetabular impingement, bone shapes, but they had perfectly functioning hips. So it wasn't the bone shapes that were causing any issues. These people had the bone shapes, they didn't have arthritis. 67% had cam impingement bone shapes, but that wasn't related at all to osteoarthritis. So you can relax on the arthritis front. Another big point that the authors make in this paper is that surgery to correct FAI bone shapes like pincer and cam impingement, as well as dysplasia, are not justified based on the research. Because those bone shapes don't actually seem to be related to the development of arthritis and hip pain, they're not something that you should go trying to correct, because it's not going to do anything to correct the problem, because these bone shapes don't have anything to do with the problem in the first place. So to recap, surgeons have long proposed that FAI bone shapes lead to arthritis and hip pain, but recent research is showing that FAI bone shapes don't lead to arthritis and hip pain. So if the bone shapes don't lead to the problems, it doesn't make sense to look at the bone shapes to solve the problem. That's going to do it for this video. I hope you found it educational and reassuring. Remember that if you want more information, you can check the description box for links to other videos about FAI, as well as the FAI Fix program, and a link to our calendar of upcoming seminars and workshops so you can learn with us and work with us live. And as always, I hope you remember that pain sucks. Life shouldn't.